Hi everyone. What we're going to do now is I'm going to show you guys how to actually conduct the end of a note. This is mainly for the residents, how a note should look like in terms of how to do certain things. So what I'm going to do is I'm going to click on, I'm going to share my screen with you guys. As you guys can see, this is a complete note. Ideally, sometimes what you guys will be doing, you guys will get a note that might be semi-complete, complete, whatever the case may be. You guys want to make sure that the note is fully complete. At the bottom, what you guys will mostly see when you guys are doing your notes is that the mental status exam and the problem and risk complexity will be done, as well as the top part of the note. What we're going to do is now we have to make sure this has to change. Give me one moment, guys. So ideally, what ends up happening is that you guys see your problem list on the right-hand side. So you guys know anything with an F code is a psych diagnosis. Anything with another letter is a medical diagnosis. We want to make sure we're only dealing with the psych diagnosis. So let's say hypothetically you're going to be prescribing, they're doing a medication refill. You guys will click the problem button right over here. You guys can merge these different diagnoses over to the assessment. So as you guys can see, I'll merge in the anxiety part and then the attention deficit. And you guys can see it merges over there, right? Another thing I can always do as well to make it a little easier, if you're doing a simple medication refill and everything is the same, I click on the drop down right over here and I click on the last one, usually will show up, which is the appointment for that specific day. But in the case where I do, I click on the two tabs right over here. I then click on the treatment right over here. When I get the treatment, I'm going to see this. Now, if I need to add a new prescription, at the top over here where it says to do, there's to do, PDMP, add info, there's something that says add. I add RX. And the add RX, I specify what diagnosis I'm adding it for. If it's for anxiety or if it's for attention deficit, I add it right over here. And then I state. So in this case, if I'm doing a new prescription for anxiety, I'm going to write Prozac and write 20 milligrams. Okay. Don't worry about any of this that comes up. Just click on yes. Prozac belongs to the same family of Remeron. Okay, that's fine. There might be other medications already on there. As you guys can see, Prozac ends up coming up right then and there. After that, I click on, if I need to add something different for attention deficit, I click here. And this one, I'm going to write Concerta. I say Concerta. And then I have a different doses. I'm going to click on 36 milligram. Click on OK. So you guys can see I have that shows up. Don't worry about this. Now, if you guys see, I'm going to X out of here that you guys can see how it looks like. As you guys can see, this shows up. If you need to change the frequency or the dose or anything, you guys go back into treatment right over here. You guys will go over into the actual medication, let's say Prozac. And you guys are able to switch it from 1 capsule to 30 days, whatever the case may be. So traditionally, we don't give any refill because we see our patients month to month. So there's no refills. You guys are able to add twice a day, once a day, whatever the case may be, 2 capsules, once a day, whatever the case may be. After I'm done, I click on OK. And if I need to do something for Concerta, I go into Concerta and I switch it myself again. I can adjust the doses right over here on the left-hand side. Tablet, I can adjust over here by writing it orally, frequency, 30 days. You guys want to make sure you write if it's for 30 days. And any notes to pharmacists if you guys have. After I am done doing all of this, I click on OK, and I am done with that certain part. We always want to see our patient every 4 weeks, so we see them every single month. So what we do is we click on next appointment right over here, right? We want to make sure that we, at the bottom where it says follow-up, we click on 4 weeks. And then after we do that, we have to add a visit code. We traditionally use codes from 3 to 5, so 99213, so 99215. So what we do is in order to get to there, we click on add E and M. And then what we do is we scroll down a little bit and we get to the part where it says OP, MD, ARNP, eval, follow-up, workman's comp. If it's an established patient, you click on established patient. You guys enter your code, which whenever you're using. If it is a new patient, we are using the parts from 99203 to 99205. Okay, again, how I get there again, I'll show you guys one more time. is I'm going to X out of this part right here. I click on if I want next appointment or visit code, doesn't matter where. I click on add E and M right over here. I then click on the established patient right over here. I have to scroll down, make sure I'm at OPMDARMP, and then I put in either 99213, 14, or 15, depending on the complexity of that patient. In this case, I'm going to give it 84 because I started new medications. I click on OK. And afterwards, I'm going to click on this button, close. Do not click done. That emphasizes the meds have been sent out. So you don't want to do that. Make sure you click on close. As you guys can see, the visit code shows up, the next appointment shows up, treatment plan, and the assessment. Now, on the treatment plan, really important when you guys are here, if you guys have any notes to add for that specific patient, what you guys want to do is you guys will mark your notes in the treatment section. So how do you guys add a note? You click over here. Give me one moment. Wait. Give me one moment, guys. You want to add. Oh, here it is. You want to make sure you click over here. This little notes button right over. Oh no, sorry, that's the wrong one. Click over here, and then where is it? So you can add your notes right over here for what's going on with the patient. Ideally, what you guys want to make sure you do is always want to do a you always want to check if there's any other controls that were being filled. So pretty much you guys want to make sure how the patient has been doing on their meds, if they have been stable on their meds, and go from there. Want to state if there are any changes. If there are any changes, please give a little reasoning why behind you're doing a change. So starting on Prozac 20, and we'll follow up with appointment. Oh, was that sometime? Appointment to see stability of patient. Press OK. What will happen next is that this will show up at the bottom of that note, the note starting on Prozac, and go from there. If you guys do have any other notes you guys want to add, you guys are able to add it, like I said, by clicking on into here and seeing what's going on right over here. Just checking to see if there's any other areas we can do that in. And that's pretty much it, guys. Nothing really different in that. If you have any questions, just reach out to us and we'll be more than happy to help you. Thank you.